Hello everyone, this is Dr. Ramya from Team MDS Conquer. In this 32 series, we are going to discuss some important points regarding physiology of respiratory system. Point number 1. The oxygen tension of the mixed venous blood is 40 mmHg. Number 2. The transport of carbon monoxide is diffusion limited because it binds avidly with haemoglobin. Number 3. Inability of exchange of oxygen through lung tissue is known as histotoxic hypoxia. Number 4. Carotid body function in an organ works as differential pressure of oxygen in arterial blood. Number 5. The exchange of gases between plasma and tissue fluid is a function of partial pressures. Number 6. Circulatory shock is an example of stagnant hypoxia. Point number 7. Oxyhaemoglobin saturation does not depend upon the skin color. Number 8. Hypoxia causes deoxygenation of hemoglobin and increases band 3 tyrosine phosphorylation and thereby stimulate glycolysis by releasing the glycolytic enzymes from band 3 on the RBC membrane. Number 9. Partial pressure is the individual pressure exerted independently by a particular gas within a mixture of gases. Number 10. Partial pressure gradient is the difference in the partial pressure of a gas between two regions that promote the movement of gas from high partial pressure to the region of lower partial pressure. Point number 11. The presence of carbon dioxide decreases the affinity of hemoglobin for oxygen and enhances release of oxygen to the tissues, shifting the oxygen dissociation curve to the right. This is known as Bohr effect. Whereas the combination of more amount of oxygen with hemoglobin displaces carbon dioxide from hemoglobin. The excess of oxygen concentration results in shift of carbon dioxide dissociation curve to the right. This is known as Haldane effect. Number 13. Pulmonary ventilation is equal to tidal volume into respiratory rate, whereas alveolar ventilation is equal to tidal volume minus dead space to respiratory rate. Point number 15. Primary inspiratory muscles are diaphragm and external intercostalis muscle. Number 16. Accessory inspiratory muscles are sternomastoid scalenic and anterior serratus. Number 17. Primary expiratory muscle is internal intercostalis muscle. Number 18. Accessory expiratory muscles are abdominal muscles. Number 19. Anemia and carbon monoxide poisoning causes anemic hypoxia, in which the oxygen content of blood is reduced as the amount of hemoglobin combining with oxygen is reduced. Number 20. Cyanide poisoning results in histotoxic hypoxia. In this, partial oxygen is normal, but the tissue does not utilize the oxygen as the poisonous substance destroys the cytochrome oxidase system. Number 21. Perfusion means the rate of blood flow to the tissues. Blood flow to the apex of lung is less, so ventilation perfusion ratio is maximum at the apex, whereas blood flow to the lower part of lung is maximum, so ventilation perfusion ratio is minimum. Number 22. The ability of lungs and thorax to expand is called compliance. Number 23. Work of breathing. It is the work done by the respiratory muscles during breathing to overcome the resistance in the thorax and respiratory tract. Number 24. Airway resistance is the resistance offered to the passage of air through respiratory tract. It is directly proportional to the work of breathing. Number 25. Elastic resistance of lungs and thorax is indirectly proportional to the work of breathing. Number 26. The partial pressures of oxygen in mixed venous blood is 40 mm of mercury and arterial blood is 95 mm of mercury. Number 27. The oxygen content of arterial blood is 90 ml%, whereas the oxygen content of venous blood is 14%. Number 28. The non-elastic viscous resistance is the energy required to overcome the viscosity of lung tissues and tissues of thoracic organ. Number 29. Hypercapnia is the retention of carbon dioxide in the body. It causes respiratory acidosis and decreases the pH of blood as the plasma bicarbonate may exceed 40 mmHg per liter. Number 30. Pulmonary circulation constitutes the entire output of right ventricle. It consists of mixed venous blood and undergoes gaseous exchange with alveolar air. Number 31. Bronchial circulation forms a minor part of blood supply to lungs and constitute a very small part of output of the left ventricle. This is important in the air conditioning of inspired air. Number 32. Lungs play an important role in sodium balance through Renin Angiotensin Aldosterone System. That's it for today's video, guys. Keep on revising. All the best. Thank you.